Everyone is talking about coronavirus, and coronavirus has now become the hottest topic of discussion. With this, there is a lot of rumor and false information that is circulating in social media and elsewhere. And this is leading to a lot of fear, apprehension, and panic amongst the general public. Many have started to say that coronavirus is actually a death sentence. This is absolutely not true. So what is this new coronavirus? Now this new coronavirus is just a new kid in town that has recently joined the coronavirus family and is exactly 60 days old since it was born on the 31st of December 2019. So it started with SARS in 2003 and then came MERS in 2014 that originated from Saudi Arabia, and this new coronavirus. It has already got its name and it is called SARS coronavirus 2. And the disease that it causes is called COVID-19. Now you may ask how it is different from the other flu viruses that we know of. Now the bottom line is that the common flu viruses or the seasonal flu viruses affect more individuals and they cause more deaths all across the globe. We know that this new coronavirus has got a transmission rate, means that it transmits from one person to another quite fast, and therefore it can lead to a dramatic or acute presentation. But the good news is that majority of this new coronavirus is still confined in China. More than 95% of the coronavirus is still within China. Now 80% of the individuals who will develop this viral infection will have only a mild disease, which means they will have cough, sore throat, fever, maybe shortness of breath, and these individuals will recover within a week or two. 15% of them will have moderate illness, that means they will take little longer to recover, while only 5% will have serious illness. And these patients may be elderly or children with low immunity or resistance to fight infection. They may have other comorbidities or illnesses like diabetes, heart failure, renal failure, kidney failure, and they may also be on drugs that may decrease their immunity. The major difference is that the fatality rate, which is the risk of dying from the infection, was much higher with SARS. It was about 10%, and it is only 2% with this new coronavirus. Now, is there any medication or treatment? Unfortunately, none. We also so far do not have any vaccine that has been developed against these viruses. So what can we do? There are a lot of preventive measures that we can take to prevent the infection. First and foremost, we must learn good personal and food hygiene, which means if you come across something or somebody whom you think may be infectious, please try to stay away as far as you can. And if you do touch something or you come in contact with somebody who may be suffering from a viral illness, do try to wash your hands immediately with soap and water. Also try to make ample use of alcohol-based hand rubs because they have been found to be effective in killing these viruses to a larger extent. In addition, you should avoid or limit your warm handshakes and warmly hugs. Please keep it for a later date. Secondly, you must learn good etiquette of coughing and sneezing. Do not allow somebody to cough or sneeze on your face, and in return, do not do the same on others. In addition, try to keep your environment as well as yourself warm, as I am doing right now. But the third and the most important thing that you need to remember, please get the information from the right sources. And if you do feel unwell, try to seek early medical help. Try to seek information from the right sources. You must have few numbers handy. You must know your emergency numbers, which you can call if you need them. Last but not the least, I would urge that do not have any stigma against someone who has got an infection. which also means that please and please do not start to hate the Chinese. Yes, please do not hate the Chinese. So you must not live in fear, but you must live with caution. With this, I wish you good health and be safe. Thank you very much.